Good afternoon, Northeast Georgia. I'm Dr. Eugene Cyndia with the Longstreet Clinic Pediatric Department. And I have with me this afternoon, Dr. Saima Hussain, Dr. Curtis Malcolm, and Dr. Megan Farley, also from the Longstreet Clinic Pediatric Department. We would like to thank you for tuning in this afternoon to our very first Facebook Live post. Now, y'all, you have to bear with us, because we know that your children will be much more comfortable doing this than we are, but we're going to give it a shot. The first thing I want to tell everybody is that the Longstreet Clinic Pediatric Department is open to see patients. And you may wonder, what have we done to protect you? And we are following CDC guidelines, as well as guidelines outlined by Northeast Georgia Medical Center, to provide the most protection that we can to individuals coming into our offices. Those protections include all of our office staff wearing masks, all of our office staff after and before visits performing infection control by cleaning surfaces, by cleaning examination rooms, by cleaning equipment that is used to help evaluate your child. We want you to know that it is first and foremost in our minds that we want to provide you a safe environment for your child. But we also want to provide a safe environment for our parents and our staff. And because of that, we are very serious about infection control. And you can feel confident that we will, to the best of our ability, protect you and your child. The American Academy of Pediatrics and the CDC does indeed currently recommend that children that need to be seen for health checkups are actually seen in the office. And we are here not for just health checkups, but we're here for all of the things that you would normally need from a pediatric department. We want to provide for you what you need. Dr. Hussain, a lot of people are asking, well, a lot of people are nervous about what's going on in the community. What can we do to protect ourselves?
Well, thank you for that question. I get that question a lot. First, it's important to know how the virus spreads. The best way to prevent the illness is to avoid being exposed to the virus. The virus is spread mainly from person-to-person contact, generally through respiratory droplets produced when an infected person coughs, sneezes, or even talks. Studies have shown that this virus can be spread by people who show no symptoms at all. So it's very, very important to practice social distancing. Please stay home as much as possible. Avoid crowds, avoid close contact with those that are sick. This is the way that we can stop the spread of the virus and also protect those that are the most vulnerable. In addition, I know everyone's heard this, but wash your hands a lot with soap and water for about 20 seconds and avoid touching your face. Please remember that these behaviors are important to model for your children. If you are around others, CDC is recommending wearing face masks made from cloth. They should be worn when you are in public, getting groceries, going to your doctor's appointments. Remember, these masks are not recommended for children that are younger than age 2. Also, remember all the things that we as doctors tell you on a daily basis: eat healthy, exercise, and get plenty of rest.
So what are the symptoms of COVID-19 in a child?
So based on current evidence, children do not appear to be at any higher risk with this virus than adults, but they can catch the virus, and children can get serious complications, especially infants. The most common symptoms are fever, cough, shortness of breath. CDC has recently added other symptoms to the list: chills, muscle aches, headache, sore throat, and loss of taste and smell. In children, symptoms have been reported of vomiting and diarrhea. Remember, this is a novel virus. It's new to us. We're learning new things every day. I want to remind everybody that if you or your children are showing any symptoms of this or any illness, we are here to provide guidance. Please call any of our offices, and we are happy to guide you with the next appropriate steps. As always, we're here to serve the community, so please reach out to us.
So what's the risk? I mean, what's the risk of each child? I mean, I've heard that this is really just a cold virus. What's the risk of really becoming significantly ill?
Yeah, so children do have less severe symptoms compared to adults, but that does not mean that their symptoms cannot be severe. And by severe, there are children hospitalized, there are children in respiratory distress. So even though they may not get as sick as adults, they can get very sick from this virus.
You know, everything that we hear on the news, everything that we see, it's doom and gloom, doom and gloom. And as a parent, that would kind of really make me nervous. And I know that even though my children never really watched the news, they were kind of aware what's going on. Dr. Malcolm, what do you think? What are some ways that we can help our children deal with or address the stress or the anxiety brought on by what's going on?
Right. Thanks, Dr. Cynthia. You're right. Children, our adolescents, teenagers, right now, they've kind of been ripped away from their traditional routine. They aren't able to participate in normal activities such as their organized sports, their other interests. They also kind of just sense, hey, this general concern that's out there in the community. So as a parent, first of all, it's really important to remember that, hey, our children are watching us. So, hey, if we respond confidently, calmly, our children, they'll use that to gauge what their response should be. So always remember that our children are watching that, and that's gonna be positive for them. It's gonna give them the assurance that, hey, mom and dad are calm. I can be calm and confident during this time that things are gonna be okay. Also, an important thing to do is with children, listen to them. They're frustrated. They're not able to have the proximity that they've had with their friends previously. A lot of them are having to struggle with the new teacher they have drawn from the amateur teaching ranks. They can't go out, which is very important for adolescents, teenagers, as well as the little kids. So just listening to their frustrations, that means a lot to them. And even if we don't respond with an answer, which, parents, we always want to do, have the answer for them, we just listen and say, yes, I know that's tough, but it is going to be a while longer before we get back to that. It allows the child to unload, which is healthy for them, and it makes them feel valued and knowing that we're listening to them. With that said, also check in. If you notice a child seems kind of excessively concerned, specifically ask them, say, hey, is there something you've heard that's really concerning you? Because, the kids, sometimes they'll get false information, and that's what's really making them concerned. And then you can address that, and either you can find out the answer together or just kind of clarify, what they've heard and let them know, no, that's not true. And that will be reassuring to them. Another important thing and that's another thing with children, especially young children, when they ask a question about what's going on, sometimes it's a good idea just to kind of answer the question they're asking. I have a 6-year-old, so I don't want to give him a real in-depth answer at times. If he asks, hey, why can't I play on the Chick-fil-A playground? I just say, hey, as we talked before, there's this germ out there, and we're just waiting for it to go away. And then when that happens, we'll be able to go back and do that again. And he said, okay. And he's back to doing what he was doing before. Obviously, that's going to be different when you have a teenager. You're going to have to answer in a different manner, more in depth. with children and our kids, also let them know that they have control. Meaning, hey, as Dr. Hussein was saying, hey, what we do to combat this, we wash our hands, we take these measures, and that keeps us safe. It makes them feel confident that they have a level of control. Another important thing when we talk about mental health, we talk about physical activity. That's good for your body, but it's also good for your brain, reduces tension, makes you feel better. Obviously, kids, they can't pursue their traditional pursuits as far as team sports, being out around other kids. So what do we do now to give them opportunities to stay physically healthy? Remember, kids, they want to have fun. So if we can get them doing fun things that involve physical activity, we're going to have a much greater chance of success. I know my kids, if they're outside playing hide and seek with their friends, they are having a blast. They can go 2 hours with no problem. My 6-year-old, if I asked him to carry his, underwear 20 feet to the clothes hamper, he's sprawled out on the floor, complaining about the excessive physical demands I'm making on him, because it's not fun. So make it fun. Fun things to do as a family walk, getting out, walking around, keeping your distance from other people. What can you do? I know I've heard people, they say, hey, make it a fun family walk. Sometimes the kids just want to take a scooter with them, play on. Some want to take a little frisbee. You can incorporate a scavenger hunt. Sometimes going outside is not an option. I've heard a lot of people, including my household, they're going online. There's great kind of almost exercise YouTube videos for little kids. And again, they make it engaging for the kids because they frame it around them being a superhero, doing these different exercises and movements as they pretend to be their favorite person that they watch on TV, and I've seen my kids and they are doing it and they're loving it. And then lastly, during the, go ahead.
Dr. Malcolm, do you think that should the parents be doing this with the kids, or should the kids just be doing it by themselves?
That's right. Obviously, we would all benefit from these exercises. As I said, the family walk, even these videos on TV are on YouTube. I've done them before with my kids. As I watch those videos, I kind of think at times, I'm like, wow, they're tricking my kid into doing these things. They aren't aware they're doing all these exercises. They aren't tricking me. I know I'm actually hurting as I'm doing these things, but it's good for everyone to do them. And then the last thing I'd say during this time, we kind of have more margin in our schedule. Well, lots of times you have more margin in your schedule. Kids have some more time. So be creative. Think of, hey, what's a new skill or pursuit they can do? What don't they know how to do? Can they do hula hoop? Do they know how to jump rope? Does the 6 or 7 year old not know how to ride a bike yet? Set aside some time every day so he or she works on that, and then make a big deal of it when they accomplish that task and make it fun.
Dr. Hussein, I want to go back to, you talked about what the symptoms are, and you talked about what the risks are. What do we do if you think your child might be sick with one of these things? What do you do?
So it's really important to call your doctor. We're still here. Our offices are open. We have developed new ways to see patients. So please give us a call at any of our offices, and we can figure out if this is something that you need to come into the office for, or if there are other ways where we can address those concerns. So it's really, really important to give us a call if you're sick, if you're having any symptoms, or your children are having any symptoms.
Right. And, one of the things that Dr. Hussein talked about was that shortness of breath or those kind of things. And those may only show up when you have physical activity, because sometimes in children, the symptoms are pretty minimal until you stress them. Wouldn't you agree, Dr. Hussein?
Yes, absolutely. And one of the other things that we're noticing with this virus is that children's symptoms are minimal compared to adults. So it's a little bit hard to distinguish what would be related to this particular virus or something else with the child. So, we're definitely here to address those concerns.
So Dr. Malcolm, you talked about all the physical activity and such. Can you address, how about the physical activity? Does it help us prevent us from getting this virus?
Right. Whenever your body's stronger, it's going to allow you to fight off any kind of, you're going to be able to fight off an infection better. Your lung capacity is going to be better if you have a stronger baseline. So the answer is yes.
So, and the answer is also yes, that if you're more anxious, if you're more concerned, you are more at risk for getting infection compared to somebody who's happy and playful and interactive. Your body helps fight off those things. Is that not correct?
Absolutely. Absolutely.
So, Dr. Farley, we talked about the kids potentially being exposed to COVID. We talked about the kids potentially, our children, what symptoms they have. But the truth of the matter is we've been doing a very good job of social distancing. And with the kids out of school, we're seeing less illness. But at the same time, we have a lot of children out there who need checkups. Can you address that for us, Dr. Farley?
Sure. Obviously, as pediatricians, we're pretty passionate about taking care of kids. That's kind of what we do. So there are several things that are going on to try to help us do a good job doing that. The first is, and Dr. Hussein started to allude to this a little bit, is we are certainly doing in-person visits for well visits and sick visits, but we've also started doing a lot of telehealth or telemedicine visits, which are kind of like a FaceTiming somebody type of thing through an app or other such thing. Not all visits obviously are going to be appropriate for that, but some are. To have a telehealth visit, and that's something that when you call the office that the staff will address with you for your child, the appropriateness of what type of visit. If something is appropriate for telehealth, you will have to have a smartphone or a smart iPad or a computer or something that has video capability. And there are different modalities that we are using in terms of different kinds of apps and things that are confidential and private and appropriate for medical discussions. And if it is determined that it would be a good idea to have a telehealth visit, the staff will work with you to make sure that you know how to access us and we can access you. So that ends up being very appropriate, especially for things like mental health type visits, anxiety, depression, ADHD type visits, some things like that. There are some other things that occasionally are appropriate, some rashes, some things like that. But again, the staff will guide you in consultation with the physicians as to what the best type of visit is. In terms of coming in for visits, we do want to continue doing checkups. Just because we have COVID doesn't mean other types of things aren't out there already. In some countries, there are increases in polio and some other vaccine preventable illnesses that we're already starting to have concerns. And so we certainly would recommend doing checkups for your child when they need vaccines. If you have concerns about something your child is doing or not doing, we have worked in the office with having our well visits come in the morning and our sick visits in the afternoon, trying to just continue to provide the safest environment for our patients. Our We Care office is still up and open and running very nicely as well, where we traditionally see well visits through 9 months and are currently seeing well visits through 12 months at this point. Again, just trying to protect our patients.
Right. The American Academy of Pediatrics does indeed, and the CDC have both made very positive statements that how important it is for children who require vaccinations to see the doctor and to have those vaccinations. But there's more than that. There's more than just vaccinations. What's some of the other things that more subtle things that maybe parents aren't thinking about that they would get from a visit, like the younger children in development?
Absolutely. Yes. Of course, the vaccines are important, but as you well know, the checkups, you're here for a while because we do lots of other things. Sometimes there's blood work that we do looking for, I don't know, lead exposure if you're 12 or 24 months old, or looking for anemia, or and then there's certainly the development, especially your first 5 years, the before school age children. We do a lot of focusing on development, communication skills, speech skills, gross motor development, fine motor development. There's a lot of things that we are closely monitoring to make sure that there are no delays and that there are no concerns. And then, of course, as you mentioned, there's things that parents may not even realize we're checking for. And our little babies, that first year, for example, we pay a lot of attention to hip exams. So we're doing a lot of manipulating of a child's hips. And that's not something a parent would know to do or how to do or what to pay attention to, but that's our job, is to know that. And so there's many things that it's our job to do that we do during these visits to make sure that if there is going to be a problem with something, we catch it early and can most easily manage something.
So if I had a question about the development of my child, could I just call?
Well, a lot of times we have to see. I mean, there's certainly, there's screening exams, and as parents know, they fill out the little paperwork. Because sometimes it's things parents haven't even thought of. Gee, I don't know, is my kid making this kind of a sound? Is my kid babbling? Is my kid pointing to things? There's just things that people don't really even notice their kids are doing until they're filling it out, saying, oh yes, they're doing this or not. But let's say there's a gross motor concern. My 13-month-old's not walking yet. Is that normal? Isn't it normal? And, we are able to not only hear what the parent has to say, but we can watch the child. What is their strength like? What skills can they do? Are they crawling? Are they sitting? What's their tone like? So there's a lot of things that we have the expertise to address or notice that, again, a parent may or may not really know, is this a problem or isn't it that my 13-month-old isn't walking?
Right. And you talked about immunizations under a year of age, but we need to remember that eventually we're going to graduate from COVID, that our children will go back to school. I can hear North Georgia applauding right now, but our kids will be going back to school, but don't they need immunizations to go back to school?
Correct. So there's most vaccinations are done within the first 2 years for children, but they do get another big set around age 4 before they go to preschool or kindergarten. Before middle school or around the 11-year checkup, there is another set of immunizations, and then there's more around the age of 16. And then, of course, we play catch up in between, depending on when we've seen our patients. But those are the traditional times. Another thing to think about is sports. Dr. Malcolm addressed how important that is in exercise. Assuming that schools open up in the fall and that communal sports or school sports restart, most sports require a sports physical, where again we're looking for things that could potentially cause a child trouble with their heart or other issues. And so if your child does do a sport, they will end up needing their sports physical as well before school start up again.
That's an excellent point. Right now, because appropriately people are staying away from each other and literally staying away from the doctor's office, because of course that's where the sick people are, right? But don't you think this is an excellent opportunity for those individuals to be ahead of the game with regard to those physicals that we're all going to need, or our children are going to need in September or August or October, whenever? So what do you think, Dr. Hussein? Is this a good time?
I think it is a good time. And of course, you've talked about measures that we're taking in our offices just to protect everyone, protect the staff. Everyone's temperature is being checked. We're doing wall visits in the morning just to isolate anyone that's sick. They will come in the afternoon. So it is a good time if you need a physical or you need your checkup done to call our offices and schedule it, and then we can get you seen.
So Is there anything that that I didn't ask that you really think that's really important for our parents to know? And I'll open it up to whoever wants to answer that.
I think I'm unmuted. I do think, and Dr. Malcolm had addressed this some, but I think it's important to be open and age appropriately honest with your children about what's going on. And as Dr. Malcolm mentioned, actively address, what are your concerns? What are your friends saying on the internet? What are people putting on Instagram? That kind of thing, because there's a lot of false information out there. And kids are not always, of any age, are not always good at telling us, oh, I'm stressed and anxious because of this. They just act out, they misbehave, they slam the door, they act like teenagers. I mean, they do other things. And so, but they still want to hear from you. They may act like they don't, but the parents, they still care what you say, and they still care that you care, that, you want to help them. So I think initiating those conversations is a very appropriate thing.
One of the things that I've been recommending now to my children and to my parents is that with this time of social distancing, that we have to be careful not to become socially isolated. That, you can't go see your grandparents because they're afraid somebody's going to make them ill, or you're afraid that you might make them ill. But rather than calling them on the phone, FaceTime them. Instead of just texting your friends, FaceTime your friends. Watch a movie together. I mean, Netflix offers an opportunity to watch a movie together. I've had some kids tell me that they've played board games together, that each of them sets up a board game and moves the board game. But I think, don't you agree that social distancing, we need to be careful not to be socially isolated?
Yes, I completely agree. Pediatricians, you often hear us touting the the evils of screen time and everything, but in this era, I mean, we can really capitalize on exactly what you said. Screen time, they can stay connected with their friends, just makes them feel so much better, improves the overall well-being during this time. I agree.
Absolutely. And I just wanted to add, with this modern technology, there are lots of apps developed for children, for teenagers, to help deal with anxiety. There are mindfulness apps, there are meditation apps, deep breathing exercises. And then to echo what Dr. Cynthia said, is that kids miss their friends. So, you can do Zoom parties with your friends and get, 6 of them together, 4 of them together, and have a Zoom party. So definitely don't become socially isolated during this time.
Excellent. Well, thank you so very much, Dr. Hussain, Dr. Malcolm, and Dr. Farley, for joining me this afternoon. Again, I want to reiterate, we thank everybody who dialed in or who tuned in with us today. And I think it's going to be available as a post on our Facebook page. So if you thought that you heard some information here that was perhaps different or perhaps very useful and you'd like to share it with your friends, please do so. If you have any questions that have arisen because of what we have said, do not hesitate to call our offices. Do not hesitate to connect to us by MyChart. If you have MyChart, we would be more than happy to answer those questions. Again, I want to thank everyone for joining us. And I think that we'll be, doing this again sometime.